Are you aware that a simple habit could be secretly undermining your health at the doctor's office? Many seniors fall into this trap without realizing it, and it can prevent you from getting the right care. Your words are the map your doctor uses to navigate your health. When those words are unclear or downplay what you're feeling, the consequences for your well-being can be significant. In this video, we'll uncover 5 common communication mistakes that people over 70 often make with their physicians. You'll learn how these phrases, which might seem harmless or even polite, can actually work against you. By understanding them, you'll not only safeguard your health, but also build a stronger, more trusting relationship with your doctor. Stick around until the end, because these tips could transform your next medical appointment. You'll discover how small changes in what you say can help you maintain your strength, increase your confidence, and enjoy a longer, healthier life. If this sounds valuable, please like and subscribe for more helpful wisdom. Let's begin. Mistake 1, the automatic "I'm fine." One of the most frequent and damaging phrases is the automatic "I'm fine." While it may feel polite or easier than explaining, it can be a major roadblock to care. If you say you're fine while dealing with real symptoms, your doctor may take your word for it and move on, missing crucial opportunities for early treatment. This often stems from a desire not to be a burden or from a generational value of stoicism. But in a medical setting, withholding details disarms your doctor. They need the full story to help you effectively. Consider the case of Mary, 76, who always said she was fine despite having dizzy spells. By the time she spoke up, her condition was more advanced and harder to treat. The lesson? Honesty isn't complaining. It's a vital step in protecting your health. Mistake 2, blaming just old age. Another common habit is dismissing aches, pains, or memory slips as just old age. While some changes are normal, this mindset is risky. Many treatable conditions, from arthritis to heart issues, can be mistaken for inevitable aging. When you write off a symptom as just age, you and your doctor might overlook a problem that could be managed or even reversed. This often comes from fear of bad news or learned behavior from past generations. But remember, a doctor's job is to distinguish normal aging from warning signs. Take Franklin, 72, who thought his chest discomfort was just age. It turned out to be heart disease that could have been treated earlier with less risk. The truth is, attributing everything to age doesn't make you resilient. It can make you vulnerable to preventable health declines. Mistake 3, I don't want to bother you. Starting an appointment with, "I know you're busy," or "I don't want to bother you," might seem courteous, but it subtly devalues your own needs. It can signal that your concerns aren't urgent, potentially leading to rushed appointments and overlooked details. This habit often comes from a deep-seated respect for authority, but in healthcare, your well-being is the top priority. Your health is never a bother. Elliot, 69, was always apologetic for taking his doctor's time and didn't mention his leg cramps. He later ended up in the ER with a blood clot that could have been addressed sooner. The key takeaway? You have a right to your doctor's time and attention. Claim it. Mistake number 4. You're the doctor, you decide. Handing over all decision-making with "you're the doctor, you decide" might feel like a vote of confidence, but it removes you from the process. While doctors are the experts, you're the expert on your own body, lifestyle, and preferences. The best healthcare is a partnership. Many seniors were raised in an era where doctors were seen as ultimate authorities. But modern medicine thrives on collaboration. Jessie, 81, used this phrase and was prescribed a medication with difficult side effects she never mentioned. Once she started sharing her concerns, her treatment plan improved dramatically. The lesson? Your voice is essential. Doctors provide the options, but you provide the context for the best choice. Mistake 5, dismissing concerns with "it's nothing." Perhaps the most dangerous phrase is quickly saying, "It's nothing, forget I mentioned it," often out of embarrassment or fear. But what seems minor could be an early clue to a larger issue. By shutting down the conversation, you close the door on potential solutions. This is a self-protective instinct to avoid scary news, but the cost of silence can be high. Desmond, 75, noticed bleeding gums but told his dentist to forget about it. He was later diagnosed with advanced gum disease that impacted his overall health. The reality is, no symptom is too small to mention. Your body's signals are important. Sharing them is an act of self-care. Which of these points resonated most with you? The language we use with our doctors is powerful. By avoiding these 5 common phrases, you empower yourself to become an active partner in your health care. Remember, you are not a burden. Your questions are important, and your details are crucial. Clear, honest communication is a key to getting the care you need to live a full, healthy, and independent life. We'd love to hear from you. Comment below with the biggest insight you gained from this video. If you found this helpful, please subscribe, and share it with someone who might benefit. Thanks for watching, and we'll see you in the next video.